and welcome to Ask the Professionals Q&A. My name is Heidi Settlemeyer, and I am the Director of Online and Community Connections here at the Arthritis Foundation. I facilitate a Connect group here in Los Angeles, and I'm also a patient who has been living with juvenile arthritis persisting into adulthood for well over 50 years now, and I'm also living with osteoarthritis. I am so pleased to have our guests on tonight, or this afternoon, Dr. Courtney Wells. So Courtney, would you like to tell us a little bit about yourself before we jump into the interview?
Yes, thanks, Heidi. Happy to be here. As Heidi said, I am Courtney, and I am also a patient. I'll say that first. I also have JRA, and I've had that for a little over 35 years, so it's been a long time. And I'm also a social worker. I'm a licensed social worker in Minnesota, and I'm a professor. I'm a social work professor, and I teach research and some other courses around social work practice. And then I also am a researcher, and I do research on young people with chronic and terminal illness, and specifically rheumatic diseases and the transition into adulthood.
Fantastic. I love the research that you're doing. It's so important and definitely near and dear to my heart. So, the events of this past year really have had an impact on everyone, especially those of us living with chronic illnesses. And developing a resilient attitude, I feel, is key to moving forward as we learn to navigate what I'm calling our new normal with COVID. So we wanted to really have this session focus in on that, because I think there are, a lot of concerns as the world is now opening back up. So let's go into those questions. So many states have lifted restrictions, but people are really still concerned because of their chronic illnesses. Do you have any tips for when we're encountering people who don't understand why some of us are still so cautious?
Sure. Yeah. I think the first thing that comes to my mind is recognizing that we can't control other people's behaviors. And really the only thing we can do is control our own behaviors and our own thoughts as much as we can. And it's really important that we use I statements when we are having these conversations with people. And typically this helps to not offend people, or at least reduce that if possible. So instead of saying something like, "You don't understand what I'm going through," you would say, "I'm still a little scared," or "I'm still a little nervous because of my health condition. And so I would like to do this, this, and this." So instead of putting the focus on them, you put the focus on yourself. So that can help take off some of that tension maybe, or some of the pressure. But it doesn't always solve all the problems. We're in a really hard situation right now, and there's a lot of judgment going around. There's a lot of feelings wrapped up in all of these. Sometimes it's also just awkward and uncomfortable, but the more you learn to advocate for yourself and talk about what you need, the easier it gets. And the more people around you hear that, the more they expect that and they get more comfortable with it.
Great. So that really does, I also hear like it really ties into setting boundaries with people, because, we're ultimately responsible for our own health and well-being. So, using the I statements also clearly sets that boundary for individuals.
Exactly.
All right, great. So the next question, and this came directly from one of our posters in the online community. "I'm fully vaccinated, but I'm still worried about variants. How do I talk to my boss about the anxiety I have about returning to work in person?"
So workplaces can be a little bit different than your home or going to a public place. First, you want to make sure that you're understanding your rights as an employee and understanding any policies that may have changed since you were working in person. I know from my experience and a lot of people that I work with that it is constantly changing still, the policies around who can work from home and when and how and all of those pieces. So I would try to do my research a little bit before going into that conversation and make sure that you have the most current information. And some things have even changed around what's considered an accommodation that wasn't before COVID. So something like working from home could now be considered an accommodation for somebody if they have a condition that suppresses their immune system, or maybe a mental health condition that limits their ability to interact with other people, or those types of things. So you really want to make sure that you have that stuff, at least your answers to those questions, before you go into a meeting like this. And if you have a diagnosed condition, so whether that's arthritis or some other autoimmune condition or a mental health condition, if it's anxiety or depression or something else, that may be a disability that then can qualify you for those accommodations. So that is one area that you're going to want to think about. If you don't have a diagnosed condition that would put you into that category, then your preparation might be a little bit different. You're still going to want to understand those policies, and you might want to frame it more as, I'm really excited to come back to work. I just need some support in trying to figure out how to get from this point to that point. And I might need to go a little bit slower, or I might need a little extra support and coming up with a plan. Usually employers are going to be helpful with that if you are excited and you want to continue to do the work and you frame it as, I want to be as productive as I can. And this is some things that I think might help or might be able to work for me. So those are just a couple ideas of ways that you might be able to frame it so that you can have a better conversation with your employer than coming in. What we usually want to do is come in and say, here's all my problems that I'm having, and I need you to help me with those, because they're not going to, obviously, that's not their job. So it's really about framing that appropriately and doing your research and making sure that you come in with that right information in hand before you start the conversation.
Great. I love that. It really underscores, creating that partnership with your employer, like, really do want to come back to work. You want to create workability, so that you can return and be productive and contributing to, whatever it is that you do as your primary source of employment. Great. So another question we had was, I used to love going out, but since COVID, I have lost my desire to be out in the world and socialize. Any tips on getting my zest for life back?
Well, the first thing that came to my mind as a social worker when I read this was wanting to explore a little bit more about why you've lost this desire and what might be going on about the cause of that. And the reason I'm asking that is because there are a lot of things that could be causing that. So it could be a symptom of something else that's happening. Could be depression, it could be anxiety, it could be grief from all the things that we've all experienced and witnessed this last year. It could be burnout, that you're really just exhausted and you've had it with all the things that, again, we have to deal with. Or you could have a physical health problem going on, or a combination of any of those things. So it would be good to have a conversation with somebody, either your primary doctor or maybe a mental health professional, about why you're feeling the way that you're feeling. And then they can help you better understand what might be going on that could be causing that loss of zest or the loss of pleasure in doing things, because that's actually a symptom of depression. And that's the word that we use, is that you have a loss of pleasure in doing the things that you used to do. So that would be my first thing, is to kind of dig into that a little bit. But if you don't want to do that, if you don't want to talk to a professional right now, or you're not ready for that, then I would start by slowly re-engaging in activities that you used to really like to do. And don't just put yourself out there fully yet. Maybe you're not ready for that, but come up with a plan of what are a few things that maybe you could go do, and you could see how you're feeling then in those situations. And maybe you could also set some goals around a future event that you want to go to, or an outing that you want to do. And that can just help you plan and have something to look forward to, and slowly work up to those pieces and not put so much pressure on yourself about needing to feel the way you did before, because you might not feel the way that you did before. The world is different now, and people are different, and we have a lot of things to process. And that's why I would recommend that you maybe try to process that with a professional, but there's also other people that you could process that with. So, and then also we can adapt a lot of activities. So if it's about fear right now and you're worried about doing activities, there are things that we can do outside now that it's summer. We can be socially distanced. People could still wear masks. There are ways to be creative and try to put the pieces together so you can still continue to do those activities. But what I'm hearing is maybe it's more about actually that loss of pleasure, and that may have a deeper root to it.
Thank you. That's really insightful. I know for myself, I've been like dipping my toe out and, getting out a little bit more, and more, and I'm looking forward to doing more of that now. So the next question, I lost several loved ones during the pandemic and could not spend time with many of them due to COVID-19 restrictions. How do I grieve and heal with the added sorrow of not getting to see them before they passed?
Yeah, I think this happened to a lot of people this year, and it's just one of the hardest parts of the pandemic. So many people did pass away alone or weren't able to have funerals or gatherings or celebrations, and there's a lot of people in this situation. And what you are describing is also known as ambiguous loss. That is a type of loss that's been described by psychologist Pauline Boss, and she has lots of great books and different materials, videos, and things available if you want to look that up and learn a little bit more about that. But it's a type of grief and a type of loss that people do experience. And the important thing is that you are going to figure out a way to work through this in the most healthy way and most comfortable way for you. And it might look a little bit different than it normally would, but we can still do some of those things that we would do if we lost somebody and we were grieving. Maybe now that it's summer, there are ways that you could go visit a special place that that person really loved, or maybe there is a grave that you can go visit and you can pay your respects in that way. It might also be possible to be a part of a celebration in a distance way or a way that feels comfortable to you. Now that things are kind of on the upswing, we can maybe get together a little bit more and be able to share our feelings and share stories. I mean, that's the big thing for people when they have a loss like this, is being able to connect with others and talk about what you remember about them and what you loved about them, and to get that out somehow. And for a lot of people, that's talking, but it could also be writing. You could write letters, you could make art, you could sing. There are lots of ways that people have been able to do that. So I would really recommend that even though it's been disrupted in some way, your grief process, that you still try to figure out ways that you can continue to build in some rituals or some sort of events that you can connect with others and try to process the loss that you've had.
Great, thank you. So the next question is, during COVID, I have indulged in some not so healthy habits or let's say coping mechanisms, like not exercising like I should, maybe binge watching Netflix, or drinking more. How do I turn things around?
I don't think you're alone. I've heard this from a lot of people that they've engaged in a lot of these same mechanisms. And partly that's because this has been so stressful and people have been stuck at home to some extent. So it's understandable that this has happened to a lot of people. So I would recommend, similar to what I had said before, about starting small and trying not to put a lot of pressure on yourself about immediately jumping into an intense exercise routine or a new diet or things like that, but that you really try to set some goals that are manageable and that you can take these baby steps to work up to, because otherwise you're probably going to get discouraged and it's just going to be frustrating at first. So try to build up your confidence to work towards the ones that seem to be most meaningful to you. And really think about what motivates you. What is something that gets you out of the house or gets you moving? Rather than focusing on maybe I want to exercise for 30 minutes a day, you could think about, well, what's an activity that I really love to do where I'm moving my body? And that could be gardening. It could be hiking. It could be going camping. It could be running, or it could be exercising, but it also might be something just that gets you out and gets you moving. And that is the perfect way to get started. So I would think about what's meaningful to you, what's motivating to you, and what are some goals that you could set to start moving yourself in that direction. The other thing that can be helpful is if you set goals with some other people, either a spouse or a friend or a family member, so that you keep each other accountable, but then that you also have somebody to celebrate with when you reach those goals. That's really important. We need rewards. We all need rewards. And that's one of the ways that you can do that. And also just remember that we're all works in progress and we're all just in this direction, but nobody has it all figured out. So you just take those baby steps and you'll get going in the right direction.
Great. That's great advice, because I know for myself that when I have an accountability partner or buddy, I definitely succeed more frequently than if I'm accountable just to myself. And you mentioned goal setting, and I think it's a perfect tie-in because the Arthritis Foundation, we have a brand new app we're launching that's called VIM, VIM, and so you have the ability to set goals. You can either use the goals that are in the app or create your own. So that could definitely support that. So,
Yeah, that's perfect.
Yeah. So another question that came up from from the people in our online community is, I know I have it pretty easy compared to some people, but some days pain, anxiety, they overwhelm me. How do I know when it's time to get professional help? And what does that look like for a first-time patient?
This is a great question and a very common question. A lot of people are trying to figure this out and often sit in this in-between place for a long time before they feel comfortable going to seek out a professional. So the general rule of thumb is that if your mental health, which we define as your thoughts, feelings, and behaviors, so if any or all of those are getting to the point where they're getting in the way of your functioning, and that could be your job. That's the most noticeable one for a lot of people, that because of their mood or because of their thinking patterns or their behaviors, they're having a hard time making it to work, or they can't seem to stay awake at work, or whatever it is that's getting in their way. It could be other things. It doesn't have to be work. It could be relationships. For other people, it really is that they're just having a hard time connecting with anybody in a meaningful way and they feel isolated. That could be another sign that there's something going on, and maybe that's what it looks like. The hard part about mental health is that it's not objective. It doesn't look the same in all people. When we're struggling, it can come out a million different ways, and that's why it can be really tough for professionals and other people to recognize what's really happening. So if you're starting to notice that you're having a hard time doing the things that you used to be able to do, or you don't enjoy the things, maybe you feel numb. That's another way that a lot of people might describe it, that they just don't enjoy their life anymore, or you're feeling hopeless. Certainly if you're having any thoughts of hurting yourself or other people, those would all be signs that you would want to be seeking out some sort of professional help. And it can look a couple different ways depending on how you're seeking those services. Just like everything, the world has changed in mental health in the last year and a half. Before COVID, there were some online therapy services available and some apps, but it has exploded in the last 15 months. So if you are more comfortable in a virtual environment, there are a lot more options out there for that. The more traditional way would be that you call an office, so you find a number, and typically the best way to find that information is to call your insurance if you have insurance. If you do, you call the number on the back of your card, and just like you would with any other procedure or any other treatment that you would ask about, do they cover it? They should cover it. They're supposed to cover it. And then how much? So how much would you have to pay if you went for the visit? So you want to make sure you understand that. And then usually they can also give you a list of the providers that they work with. Just like with medical appointments, they should be able to say, here's a list of providers in your area that we would cover. And I like my insurance, it really is helpful. It's really quick, easy process because it's all online. I can just go online and there's a website and it says, here's all the providers and here's all their phone numbers. And then I can call them and make an appointment. And typically for your first appointment, it's going to be a little bit longer potentially, and you're going to have a lot of paperwork to fill out. Just like if you were starting with a new primary care doctor, they are going to ask you a lot of questions about your past and about your current situation, and if you've had any challenges in the past. So all those different things are going to come up, and then they're going to do an evaluation during your first meeting, typically, where they're going to, again, ask you, you're going to fill out those surveys, and then they may also ask you questions in person to better understand what your symptoms are and what is going on with your situation. And it really is not a lot different from what you would do in a medical appointment, except they're going to be asking about your emotions and your behaviors and your thoughts more so than your physical body. But they will ask some questions about your physical body as well, because those can be symptoms. But there would never be an exam or anything like that. So it's talking and filling out paperwork. And then usually after that assessment, sometimes it's during the first appointment, or sometimes it would be during the second appointment, they will tell you what type of condition they think you might have if you have one, and what types of treatments could be available. And then you would have a conversation about where you would go from there and create a treatment plan that sounds good for you and for the provider.
Great. And are there any alternatives to therapy, or what other options are there?
Yeah, that's a tricky question. So, I mean, it kind of depends on what you're looking for and what symptoms you're experiencing. There is no one thing that could stand in for talk therapy. There are medications, and medications can be very helpful, and those typically are prescribed by either a primary care doctor or a psychiatrist, could be other medical doctors as well. Those can help with some of the symptoms, but the recommendation is really that you would pair medications with talk therapy. The medications are most effective when they are paired with talk therapy, and there's evidence to show that for a really long time. So that's ideal. Some people would prefer to just take the medication, and sometimes that will help for people. But therapy is really about expressing your emotions and getting out the things that are building up inside of you. So you can do that with other people if you want to, if you're willing to be vulnerable and comfortable with people in your life. But the problem is your family members and your friends, they're not objective. They know you and they're attached to you, and they have an agenda, whether it's good or bad. They have an agenda of how they want you to do. And the therapist should not have that. And the therapist should be seeing you in as objective way as possible. And they're treating you the same way that they would treat others. And they're going to give you that feedback. They're going to tell you what they think is really the best way to do things. And your family and friends may not do that, and they may not have the education and expertise to appropriately do that. So that's why a professional really is ideal in those situations. And there are plenty of things you can do also to deal with some of these symptoms. So exercise is extremely effective at helping people with anxiety and some types of depression. In fact, there's some studies that show that it's just as effective as taking antidepressant medication. But it's only going to help for certain things and certain people, and you have to do it so many times a week, and all those pieces have to be true. So that's definitely one tool, and most therapists would recommend that you do that as well. And then there are things like meditation and different mindfulness practices that can also be very helpful, but they really aren't going to get to the root cause of what's going on like a therapist could. They're going to help you develop coping tools to manage the symptoms that you have. And that's the same thing with exercise, and the same thing with things like journaling and making art. They're going to help you manage those symptoms, but they're not necessarily getting at that root of what's going on and why are you having these things. And sometimes we can't figure that out. We don't know why you're having it. And other times we can start to explore that a little bit in therapy.
Great, thank you. Now, are there any tips for making therapy more affordable? Because I know people have concerns about,
I know. Well, the best thing is if you have insurance. I mean, it can be pretty affordable. I think when I go, it's $10 or maybe $20 or something like that, because I have insurance and it covers most of it. But if you have a high deductible plan and you have all these loopholes and all these things, then it can be pricey. So in that case, you're going to want to start with your insurance company, and then you want to talk with, if you have a therapist identified that you want to work with, I would call them and have a conversation and say, I really want to come work with you, but here's my situation. Many therapists will do a sliding scale fee where they will charge you based on your income, or they will work with you on a payment plan, or those types of things. So I wouldn't be hesitant to ask about that. Not everybody's going to be willing to do that, but a lot of people I know who are in private practice do that regularly. There are also, I live in Minnesota, and I know in the Twin Cities, there are walk-in clinics that are free, that are staffed by volunteer mental health therapists. That's not really for long-term work, but that can help in between or in a crisis where you don't quite know what you're doing yet and where to go, and they can help refer you to other places. So some cities might have resources like that available as well.
So a question that one of our people in our online community asked was, how do I know if I need medication for my anxiety or if it's normal jitters?
Yeah, not an easy question to answer. So you want to go back to the point about, is it getting in the way of your functioning? So is it preventing you from being able to do the things that you need to do to function in your life? Or it could even be that it's preventing you from enjoying your life. Those are the pieces that's a red flag. Like something's going on and I probably need to do something about it. Many people will start by trying to manage it themselves. And sometimes it is doable. If you get an exercise routine and you get, maybe some people change their diet in certain ways that we don't know if that helps a lot, but some people think it does. Things like caffeine. Caffeine is really bad if you have anxiety. You probably shouldn't drink caffeine, but a lot of people do. Or smoking. So if you're taking any sort of stimulant, that is going to increase your anxiety. Things that also, like alcohol, are going to increase your anxiety because that's a depressant. And so that again is making your body work in ways that it's not balanced. And then it ends up potentially causing other symptoms. So things like drugs, things like not getting enough sleep. There are lots of different ways that we can try to adjust our life and our habits, but a lot of people struggle to do that by themselves as well. So usually people need some extra help if they've gotten to the point where they are having a hard time functioning, or it's impacting their relationships, it's impacting their money, all the different parts of their lives. And the other thing I like to clarify with anxiety, so anxiety is not the same as being nervous. We all have nerves. We all get nervous before certain events or certain things. We all have anxiety to some extent about an upcoming event, or we all have sadness. So these emotions, there's nothing wrong with these emotions. They're healthy and they're part of the way our system is built in our bodies. But that problem becomes when they take over your life and all you are doing is thinking about how uncomfortable you are and you can't listen and you can't do the things that you need to. So that would be the warning sign there that you've crossed into needing some help.
Great. Next question. This year really knocked me down. What tools can I use to develop resiliency?
Yes, I think this has been true for a lot of people this year. The way I think of resiliency, again, I think a lot of people do, is kind of like a scale. That you have a scale, and on one side you have risk factors. So those are the things that make it more likely that you're going to have some challenges, that you're going to have lower resilience. On the other hand, you have protective factors, and those are the things that protect you from that stress in your life. So what we want to do is try to have more protective factors and less risk factors, but we can't control all of that. Things like genetics. Some of us are just wired in a way that we're going to have depression or anxiety, or we're going to have arthritis, and we can't do anything about that. But then we can try to add other protective factors. And those are some of the things that I've already talked about, like exercise and sleep and healthy relationships and your diet. And all these different pieces are things that you can add to try and balance that scale out a little bit. And unfortunately, for those of us who have a rheumatic or an autoimmune disease, that's a big risk factor that we already have. And that adds a whole other layer of stress to our lives anyways. And then we added the pandemic on top of it, and then it added a whole bunch more stress. So the scale's a little bit unbalanced right now. And for most of us, we have to figure out, well, how can we proactively balance that back out? And for a lot of people, I think that's also about re-engaging in some of those relationships that we've had to either put to the side or minimize a little bit during this time. And that might help with some of that protection around the resilience. But you have to think about for yourself, what is meaningful to me? What gets me excited? What makes me feel happy or gives me peace? And you need to bring as many of those things in your life as you can, and then take out as many of the things that are causing you stress.
That's awesome advice. Thank you. So the next question came from one of our JA parents. So she wrote, or he wrote, not quite sure. My kid has JA and is not vaccinated yet. My family is still not comfortable completely lifting COVID restrictions. Do you have any suggestions to help young JA kids stay connected and active during this stressful time? And then tied on to that is, how do I explain to my child that even though their friends are hanging out now, that she still needs to be a little more cautious?
Yeah, I am thinking about this a lot right now. I'm a social worker at our camp here, and we are doing virtual camp and trying to make these decisions, and it's very hard. And I know that a lot of young people are really struggling, just like adults, because of the cutoff we've had from different people, whether it's school friends or other types of friends. And it's really essential that they maintain those connections. So my first advice would be to talk with your rheumatologist or healthcare provider about how cautious your child needs to be at this point. And this is going to depend on their medications, their health status, and their vaccine status, as well as their age and where they're at in all these pieces. And because things are different also in different places in the country, some areas are probably a little safer than other areas. So I would recommend that you get their input on what do they think is safe at this point for somebody with a rheumatic disease, and maybe who's on immune suppressing drugs. And then depending on how old the kid is, I would include them in these conversations so that they can understand from their healthcare provider what is the best thing for them to do and why that is. And their provider might say, you can do more than you think you can do, or they might say you need to pull back a little bit. So depending on where you're at, you might get a different answer there. And it would be good to hear for your child to hear that from their provider. And then depending on what you get from that, I would try to create some opportunities for her to find times to connect with her friends. And given that it's summer, there's probably ways to do that safely now. It was a little bit different before summer, but probably if they're outdoors, there's a way to stay distance and even wear masks if that makes people feel better, that we couldn't do just a few months, well, at least here in Minnesota, we couldn't do that a few months ago. So it's really about balancing the physical risks along with their mental health and their sanity. And I've talked with some people. I'm doing a research study right now about COVID and this exact decision-making process. And a lot of people are saying that at first they were more cautious physically and they were taking all the precautions. But as time went on, they started to realize that their mental health was really suffering and that they had to loosen up some of those things and find a way to still maintain their life and their identity without giving up everything. So it's this balancing back and forth. And again, depending on how old your kid is, this might look very different. Teenagers are going to have a different balance than a very young child. And of course, there are many online activities, including summer camp that's going to be happening virtually, but they also might need a break from screens, and you should support that because they really have had a hard year. So I would just safely try to figure out as safely as you can a way for them to connect with their friends.
Great, thank you. I know I saw this, one of my friends had to make that decision for her family because it really did become a mental health issue as well. It was impacting her mental health as well.
Well, and honestly, we're seeing, at least here, we have no mental health beds open in the whole state. We've never been so taxed as far as people suffering from mental illness right now. And that includes teenagers and young kids. So this is a very real risk that we are taking on. And sometimes I think people automatically assume their physical health trumps their mental health, but that's not true in a lot of situations. So it really is about balancing them out and trying to figure out how can we prevent people's mental health also from getting worse down the road. So there's lots of things to take into account.
Great. Well, thank you. Yeah, part of my intention of this conversation was to help, dispel some of those concerns that people have, because, I feel like sometimes there's still a little bit of a stigma or not as much attention put on mental health. And it's so important to our well-being, for sure.
Yes.
So we're coming into our last question. So this question is, do you have any tips on how to explain chronic fatigue to my spouse? I feel as though my spouse doesn't understand that sometimes I need to pace myself, even though I look and seem fine?
Yes, I really understand this question. I've been married for 15 years and my husband's a psychologist, and I'm still trying to explain this to him because it is hard. It's hard when you're not living in somebody's shoes to really understand what it feels like. They can see what they can see, and not for us, a lot of times they don't see anything. And then they just really don't understand. So the first thing that I thought of was the spoon theory, which was developed by a young woman with lupus who described to her friend how it felt to have lupus. And she did this by giving her some spoons. She gave her a big pile of spoons. And then she explained, this is all the energy that you have for a day. And then slowly she walked through the process of that day and took away spoons every time they talked about a new activity. And the idea is that you start off with a certain amount of energy each day. And for those of us with a chronic disease, we often start off with less anyways than other people because we don't sleep well and all sorts of things. But then as you go on throughout the day, you have to really think about conserving your energy if you want to have it for later. And that's the piece that sometimes people don't think about, especially when they're young. As people get older, they start to think about this a little bit more. But daily activities take a lot of energy for people with chronic pain or exhaustion or lots of different symptoms, and it may not be visible at all. So that's one way to think about it. The other way I've explained it to my family is I typically feel like I'm coming down with the flu. Like I don't have the full flu at this point, but it's like that day or those few hours before when you start thinking like, oh, I don't feel very good. That's how I feel most of the time. And then they kind of get that because people can relate to that. They've experienced that before. And when my husband has had that situation, and then I'll say like, see, that's how I feel all the time. And then that kind of helps make some of those connections. It's impossible for them to truly understand what you feel like. And that is also where it's important for you to have other people to talk to who do understand what it's like, because that's also part of the equation, is that your spouse may not be fulfilling some needs that you might have for that emotional connection piece. But then it's also important for them just to have a general understanding of what can they do to help you or to support you as you go throughout the day. And you might just have to be really explicit. Look, this is what my day looks like. And this is how much energy I have to use. And if you want me to go to our kids' baseball game tonight, then I can't do these other 3 things or however it looks like for you. But those are just a few ideas. Yes.
Great. Those are great suggestions. I share the spoon theory regularly, as a facilitator of one of our Connect groups. It's like, here's a tool you can use with your spouse or loved ones. So, thank you, Dr. Wells. I really appreciated having you with us today. Your willingness to tackle these questions and get them answered. And, really the opportunity to educate and provide some sound advice for our patient community. So, going to talk about the next month. So if you want, or you're curious to know what our next month's topic is, visit the Live Yes online community at liveyes.arthritis.org on July 1st, and we'll reveal our next topic in Ask the Professionals Q&A discussion. And to learn more about the Arthritis Foundation and our awesome programs and services we offer, please visit arthritis.org. We have these great patient education events, all sorts of webinars, podcasts, our Connect groups, which are our support groups, our online community, and our Insights program that all are for the patient community. So on that note, again, thank you so much. It was great connecting with you again today, Dr. Wells, and have a great afternoon.
Thanks for having me.
You're welcome.